Good day, my dear students. Welcome to the series of classes on autopsy. In today's world of telemedicine, molecular pathology, and robotic surgery, autopsy seems to have been pushed to the backyard, only to come back again. Welcome to the class. The image that we see on the screen is the courtesy of Moped. And I hope you people will be able to trace what it is. Always a couple of books ought to be there in our possession or the bookshelf or the library in its physical form. And they are Autopsy by Autopsy, Autopsy Practice, and the series by Ludwig, because these books have stood the test of time. A good book is the precious lifeblood of a master spirit. John Milton, a blind poet. To serve with thanks. I hope you recognize our teacher on the screen, Dr. Lanjeva. He was my professor at the Grant Medical College during a short tenure. And his book, Autopsy Practices, is worth mentioning, possessing, reading, and reproducing. And this was the wonderful Grant Medical College where I was posted for a month. The value of it you people shall be appreciating in the subsequent slides. Autopsy by itself has got its own history. Way back in 3500 BC, it was started in Babylon, continued in Egypt, and around 33 BC, Julius Caesar was conducted an autopsy upon after having been murdered. In the 14th century, the dissection became a regular curriculum in medical education. On the screen again, I am seeing Morgagni, an Italian physician and an anatomist, a philosopher, an artist, and to some extent, a pathologist and a lawyer. What is an autopsy done for? Long back, it was done to study the symptoms and the manifestations in the affected parts, whether they are correlating and matching. It was done without the decree of the religious bodies, because a lot of inhibition was there then. And in the so-called modern era, though this itself looks old, it was well established by Rokitansky, Ludwig, and Rudolf Virchow. It has got its own history in India also. Started around 1822 in the Calcutta Medical College. Continued in the Grant Medical College, following which there was a Coroner's Act that was established, and the coroner happened to be a counterpart of a magistrate stated within. Therefore, Mumbai is a free-flown access for all autopsy proceedings. The autopsy techniques have been described by many a personnel. On the screen, we see the father of pathology, Rudolf Virchow. He removed the organs one by one, then the cranial cavity and spinal cord, thoracic, cervical, and the abdominal organs. The advantage was, since everything was piecemeal, it was easy to be done, quick. But the disadvantage was the relationship of one organ or a lesion to another could not be very easily established. Then came this in situ dissection. The organs were removed en bloc or en masse. It was supposed to have been described by Rokitansky, whom we see on the screen. But then it was originally established by Ghosn and Lethal, whom we shall see in the next slide. The advantage in this case was the relationship is maintained, particularly for a transmissible disease. For example, the trachea, the bronchi, the lungs, or the esophagus, the GIT. The disadvantage was after removing en masse, they are all fixed and only later on they are studied. As a result of which, the observation is second and description. These were the couple of gentlemen whom I had mentioned earlier. Ghosn. What he did was he removed the thoracic and the cervical organs and then the abdominal organs en bloc. Lethal was a person who is supposed to have preceded in the en masse dissection prior to Rokitansky. In this, the thoracic, cervical, abdominal, and pelvic organs are removed en bloc as one. And then they are dissected into the organ blocks. We shall be seeing how. The advantage was the body is available to the undertaker in 30 minutes. The disadvantage was the organ mass is awkward, difficult to handle. This is a wonderful chart of the history of autopsy thanks to Langevin and his text. Started with Antonio Beneveni, Morgani, Xavier Richard, Rokitansky, Furco. These are all pathologists. And surprisingly, all of them were from in and around the countries of Italy, Austria, and Germany. Probably that was a center of the medical hub at that time. And these are the various contributions by the corresponding people. I would like you people to go through this chart leisurely. A misfit, or rather, a genius in this was Sir William Osler. He was a physician and a giant in clinical medicine. And he came from Montreal, Canada, and none of these countries mentioned over here. He used to say that as is your pathology, so is your medicine. Sir William Osler. There were certain norms in the post-mortem and in autopsy, in the cadaverium. And these terms were established by Mary Xavier Richard. And subsequently, the autopsy was divided into pathological autopsy and forensic autopsy. Pathological, dealing with the medical illnesses, and forensic with the medico-legal cause of death. Whenever there is a norm, there is a form also. So you people should be familiar with the autopsy forms. In fact, it forms part of your logbook and your record. You are supposed to be familiar with the various nomenclatures, the sequence. It is more or less similar to a case sheet, but then certain terms such as the birthmark or any of the congenital anomaly, the scars, the height, the circumference, or any obvious jaundice or swelling will have to be mentioned. And organ by organ, system by system description is mandatory before you reveal a final diagnosis. Whenever we talk about autopsy, we think it is an area that should be shunned. It doesn't look like that. Look at the table over here, and it has got a provision for a wonderful drain. Also, you find that there is a side sink in which there could be the provision for washing and the collection of the various material. The prosector is a person who carries out the wonderful task of performing an autopsy. There is also a course that is recognized and renowned, paving way for a good profession, the prosector. And this is a place where the dead are teaching the living. Go to PIMS, Pondicherry Institute of Medical Sciences, where you shall find it at the entrance of one of the museums. This is a little better than the previous one, wherein I'm finding a mobile table wherein the autopsy can be performed. And this looks almost like the provision that we see in an operation theater. There is the various set of tubes which can do the flushing and so on. Also, I find that there is a collection material for maybe fixation of specimens or microbiology or biochemistry whatsoever. An X-ray lobby is mandatory in an autopsy theater because you have got a right to see and measure whether there is any abnormality, a fracture, so on and so forth. Also, you find that just like a theater, you find that there is a display board displaying the list of autopsies to be done. Who actually controls or gives you permission to perform an autopsy? We shall be seeing. So these are the other things that are required. An MRI or an X-ray, or at least the report should be available. It is like a mini theater. Endoscopy and needle biopsy are also done to aspirate the contents to assess the cause of death. And a needle biopsy, if it is going to be urgent, and the particular site will be sampled. Compare those pictures with this. And this is actually a darling of us which has revealed many a disease without which we would not have known the infective endocarditis or the rheumatic heart disease, etc. An autopsy can be partial, it can be complete. Complete is what we conventionally do. Restricted when only that particular region is being studied. Anatomical dissection is also an autopsy for teaching purposes. It is to study, autopsy in general is to study the medical error, the cause of death, and to prevent such death in future. That is how there has been a subsequent improvement in the modalities of treatment. And almost a similar one, an ancient autopsy room, almost it has been abandoned. Look at it. But this has been a place that has taught us a lot. And compare it with this. Not very modern, the John Hopkins one, but then it is neat, well illuminated. The table is over here, a wooden table in this case. There is a provision for a drainage and all the side shelves and containers for what we had mentioned earlier. Coming to the question of who gives you a permission, it has to be done by a magistrate, not a judge. The magistrate is the counterpart of a judge in criminal cases. The coroner himself is a counterpart of the magistrate. Either of them can give the permission or a direction for an autopsy. In the institute, it is the RMO, the residential medical officer. Also, the family of the deceased, they should be present so that there is no ambiguity or counterclaim at the end of it. If these are not in sequence, then a police station can ask for an urgent autopsy to be performed, particularly when it is a case of an abandoned body. All said and done, it has to be done by qualified MDs, which however is not possible. And in many a district hospital, you find that the MBBS doctors or the senior other professionals do it. This is Andreas Vesalius, a wonderful person, a controversial person who used to exhume, that is, after burial, he removes the body and takes it for dissection and for teaching. A fantastic teacher of anatomy. Without him, many a structure would not have been known. Humani Corporis Fabrica, a book of his. Coming to the external examination, this is a usually asked preliminary question in the exam. What do you look for? It can be hypo or hyperpigmentation, congenital anomalies, a cleft lip or a cleft palate, supernumerary digits, etc. Whether the patient is in cachexia or the cadaver because of severe malnutrition or advanced debilitating disease. Gigantism, acromegaly, etc. can be features of an endocrinological disorder. Dwarfism, cretinism, etc. Rigor mortis or a rigidity indicates that the death has occurred within 48 hours and it is due to the excess of ATP. Livor mortis, on the contrary, is stasis that is observed before 45 minutes. There can be putrefaction or cyanosis, be it peripheral or central. This is the case of hypostasis, wherein there is a dependence, and you find that there is a stasis. This is the venous blood, obviously bluish in color. Sometimes you can have a hypostatic pneumonia in the lung and an acromegaly. In this case, I find that there is a hyperpigmentation, particularly in the armpit. A classical case of acanthosis nigricans, it can be associated with any visceral malignancy such as a gastric carcinoma. Commonly, in this case, it has been with renal cell carcinoma. Fungal diseases, leprosy, ochronosis, tattooing of the skin. This is important for the identification as well. Any injury or bruise. After the inspection, initially, what are the measurements and what else do you see? Head size, for example, hydrocephalus increased, microcephaly decreased. And the eyes, many a thing can be seen, such as jaundice or a KF3. In the neck, distended jugular veins indicate an underlying congestive cardiac failure. Enlargement of the thyroid, lymph nodes for metastasis. Upper extremities, a unilateral edema indicates a mass dissection of the lymph nodes in the case of CA breast. Clubbing of the digits, asymmetry in the case of either a collapse or in a case of bronchiectasis, etc. Emphysema, wherein you find a barrel-shaped chest. So here I find that the ribs are more or less horizontal. There is an increase in the anterior-posterior diameter of the chest. Other things can be kyphoscoliosis. Many a disease can be the rickets, osteomalacia, to mention. Abdomen, organomegaly or ascites, any hernia. Genitalia, gangrene of the scrotum. Lower extremities, either a pitting or a non-pitting edema. Non-pitting edema can be for filariasis. What are the general policies of autopsy as such? It is a wonderful technique that should be learned at the autopsy. Do not try to learn clinical medicine without going to the hospital. Nowadays, everybody is doing it online, including my own class. This is a time-honored method, and printed audiovisual methods are not equivalent to the autopsy techniques at the autopsy. The pathologist who perform should be familiar with the techniques and the findings thereon. Medico-legal is slightly different, and they should be well versed both with law as well as the technique. In adult autopsy, these are all the various things that we'll have to look for. Many of them have been mentioned, others can be a repetition. So, for example, a pneumopericardium. What are the contents of the pleural cavity, etc.? This was one thing that was displayed to us when I was a student at the Grant Medical College. Professor Langevar was performing an autopsy on a HIV patient. He opened the thorax, pleural cavity filled with pus, empyema, and he was thrilled. Abdominal cavity, again showing pus. Spleen showing multiple abscesses. He was at the height of his happiness because he's a dedicated person who has done autopsies in any number of these HIV cases and published that. So kindly go through this particular one. It is worth its weight in gold. And this is incidentally the source of it. And those who want can go to the complete reference mentioned over here. Autopsy is not a haphazard procedure. It is a step-by-step sequential act. For example, ligature of the major blood vessels. This is mandatory so that you can remove the blood, perform an embalming, see that the fixative flows to all parts of the body to preserve the body as such. And then the neck and the floor of the mouth organs, care to see whether it is strangulation or any other mark, brain, it should be removed to avoid hemorrhage. Otherwise, what happens is when I cut the floor of the mouth and then put a slit, there can be profuse hemorrhage, which can be avoided by removing the brain first. These can be studied if required. So this is the process going on or having gone on in Egypt. That is why you find the Egyptian mummies still being well preserved. And they thought initially they are getting rid of a evil spirit. And these are the incisions or the slits wherein you will be able to perform in the embalming. So these techniques have been earlier mentioned, just recall them. Now, how do you decide what is the method for autopsy? It can be a total macroscopic study, it can be a clinical correlation, it can be of medico-legal importance, for teaching purposes as an anatomy, for research, for personal things, such as a person who is interested in a particular congenital series of anomalies in a particular region, the branchial cyst, etc. Institutional and for economic reasons also, you find that it can be restricted and not very long. And after all, death is the best teacher. When I say adult autopsy, there has to be a pediatric autopsy. Pediatric autopsies are seemingly simple and they do not require any special permission. They can be done straight away in the pathology department itself. But it should be done by people who are experienced in perinatal pathology. It came into force in 1995 in AFIP, America. As usual, external examination, malformations. The placenta umbilical cord also should be examined. The fetal brain is removed. Opening is not difficult because there is no hard and fast sutures. And you will also have to look for any malformation such as Arnold shear. And this incidentally is the third leg of sacrococcygeal teratoma. Fetal autopsy. So here on one side, I told you about an asymmetry. So one side it is well aerated, where on the other, I find that it is almost solid thanks to the consolidation that is seen. But still there are some slit-like spaces which can be vascular channels, and it is a case of lymphangiectasia with collapse, of course, leading to pneumonectomy. So for infants, minimum treatment for autopsies. It is a minimum requirement. And major organs should be removed, such as those mentioned over here. Costochondral junctions, if you want to rule out anything like a malnutrition or any abnormality. And also, we will have to rule out a pneumothorax or collapse of the lung, etc. These have been already mentioned. And there are certain special techniques which can be applied as and when required. Opened underwater, study for arteriovenous malformations, removed en masse, and bits from multiple organs, cord, etc. And now, what are post-operative autopsies? They are done to study the surgical procedures, its cause of death, or the effects of the anesthesia, or any of the medical treatment that has been given, the drug-induced changes, and also to study the medico-legal implications, aspirations, etc., so on and so forth. All said and done, this has to be done by an experienced pathologist, preferably with the help of a surgical assistant. Even otherwise, a telephonic clarification, video recording will be mandatory. Complete case notes and radiological findings are needed. Areas of surgical incisions and sutures must be avoided during incisions at autopsy. Study the wound dehiscence, fistula, drainage, etc. And any stasis or discharge, let it go in for a microbiological study. The organ should be removed en bloc after abdominal surgeries. Notes, photographs again. Words do not matter. Photographs do. and no premature postmortem diagnosis must be revealed. There is something called as immediate autopsy procedures. When should we do an immediate autopsy? After all, you find that there are cadavers and cadavers lying over there. But there will be some cases where it should be urgently done. One, it is getting decomposed, not suitable for culture or cytology. Two, when there is difficulty in procuring a permission, you will have to go ahead. Modified Y-shaped incision can be done for a different reason. Urgent sample removal is required, as in the case of poisoning or any of the drug intake, etc. Snap frozen. A frozen section can be done even on this before it is being fixed. Tissue culture, obviously, to find out any of the abnormalities. Electron microscopy with fixation in glutaraldehyde. Bone marrow aspiration for hematological disorders. And immunohistochemistry, these also can be done on the lesions that have been. All should be done with the help of the prosector technicians. And this is the entire list. You can do a needle autopsy at that particular organ whenever you want to avoid a delay. Endoscopy, it can be done. Neoplasms, you find that again, a slit biopsy can be done. Restriction in the case of skin incisions, abdominal along with the consent. Then, of course, there are areas such as the hands, face, arms, etc., where we usually do not tamper the body. So these should be avoided as much as possible, and at the bone, see whether any processes is. So these are all certain things that will have to be looked for. And if there is going to be a disfigurement, etc., there can be a reconstruction of the face by petroleum jelly, gauze, plaster of Paris, cardboards, moldings of the dental, and mask preparation. This should have been one of the first points. How do you identify a cadaver? It should not be mainly by means of the number or any other scar mark. Tattooing can be taken as a permanent mark, any of the mole or a birthmark, congenital anomalies, the dental abnormalities, a cleft lip, cleft palate, etc. All these can be made use of. Mark of a whole surgery. So all these are required in the identification of a cadaver. And this is what Aristotle has said. Knowing yourself is the beginning of all wisdom. Maybe autopsy, we are knowing ourselves. See, they're telling you the truth. Just listen. These were one of the words of a forensic professor who visited our institute. This is an en masse dissection by the Lethiel or the Rokitansky's method. There is a trachea over there identified by means of the rings. This is the anterior-posterior view, and this is the posterior-anterior view. And after having been removed, I'm able to see the lungs and the heart is over here. Lower down, there are the abdominal organs. And still lower, there can be the bladder and the other viscera. What is done here is, I'll be able to slit the junction between the trachea and the esophagus behind. So trachea is anterior, esophagus is behind. So what happens is, once it is being split, the esophagus is deflected onto the abdominal side. That is one part of it. When I turn it back, I find that there can be the great vessels, the vena cava and the aorta. Similarly, these also are separated from the remaining viscera, and these are reflected onto the thoracic side of it. So esophagus comes to the abdominal side, then the great vessels go to the thoracic side, and the diaphragm is paired or separated over here. Ultimately, I have the thorax and its organs, namely the blood vessels, and the abdomen and its organs, namely the esophagus. After which, there can be the removal of the en masse, but there has to be a fixation. Sapphire was a person who explained the delicate method of separation of the great vessels. Autos means oneself and opsis is sight. Necropsy or necrosis, study of the dead. Whatever be your autopsy, you'll have to return the cadaver with dignity. So the suture mark should not be haphazard. You need not be a plastic surgeon, but it should be as decent as possible. Avoid trauma. There should be a neat suture. Scalp, it should be closed. Because of the hair, generally it is unnoticed. And ultimately, there has to be a decent burial or returning it to the relatives. Andreas Vesalius again, teaching anatomy. One can survive everything nowadays except death. And he can also live down everything except a good reputation. And what is the message for the day? One can survive everything nowadays except death. And he can lay down everything except a good reputation. Oscar Wilde, a playwright and a novelist. Our classes on autopsy shall be continued.